Presentation is OCT findings in large full thickness macular hole after ILM peeling with multi-layered inverted flap technique. Presenting author Dr. Binoy Patil.
So good afternoon, everyone. So I shall be presenting the OCT findings in large full thickness macular holes after we have done ILM peeling with multi-layered inverted flap technique. So we know that pars plana vitrectomy with ILM peeling is a standard of care in large full thickness macular holes. OCT helps in surgical planning and prognosticating for anatomical and visual outcomes in full thickness macular holes. So correlation of OCT parameters and visual outcomes have been done in multiple studies. Now we are moving towards more functional outcomes in macular holes as compared to prior, where anatomical closure was the primary expectation. So we also expected to see the ellipsoid zone restoration and external limiting membrane restoration and correlate them with the visual outcomes. So basically, aim of the study to characterize the optical coherence tomography findings in large full thickness macular holes following ILM peeling with multi-layered inverted flap technique. So ours was a retrospective observational study. So we included 21 eyes. Surgical technique was pars plana vitrectomy with ILM and multi-layered inverted flap. We used gas tamponade, which was SF6 in majority of the eyes. Surgeon was a single surgeon. Platform was Ingenuity 3D heads-up digitally assisted surgery. The follow-up was minimum of 6 months. Imaging was done at 1, 3, and 6 months during the follow-up period. And imaging platform was Topcon Swepsos OCT. Preoperative parameters like minimum linear diameter, hole height, basal diameter, macular hole edges were assessed. And post-operatively, we see type of hole closure, appearance of subfoveal ellipsoid zone, external limiting membrane, retinal dimpling, and Donful were assessed. So preoperatively, majorly I want to highlight that the mean linear diameter of the holes was 667 plus or minus 154 microns. Majority of the holes were larger than 550 microns, and majority were more than 600. And mean BCVA was 1.33 plus or minus 0.41 logmar units. Post-operatively, the type of closure in about 92% of eyes showed type 1 closure, which is V or U, and about 9.52 showed type 2 type of closure. And at 6 months, the visual acuity BCVA achieved was 0.9 plus or minus 0.34 logmar units. And in about 8 eyes, that is 38% of eyes, we saw the restoration of subfoveal ellipsoid zone. So basically, as I said, in 90.48% of eyes, we saw type 1 closure, which is U or V shaped with the multi-layered technique. And eyes which achieved subfoveal ellipsoid zone restoration had a mean linear diameter of 610 plus or minus 101 microns. And subfoveal ellipsoid zone restoration corroborated with good BCVA with the minimum of 15 letter gain at 6 months following surgery. And there was no significant difference in BCVA achieved in eyes with or without Donfil. And presence of retinal dimpling also did not change the final visual acuity at 6 months. ILM restoration was seen in all the eyes which had EZ restoration, which is logical explanation for that. So basically, the drawbacks of our study is we didn't have a comparative arm which compared it with standard ILM peeling technique. And studies have shown that ellipsoid zone restoration and ILM restoration takes longer time, more than 1 year. So we had a smaller, shorter follow-up period, that is 6 months. So we intend to extend the study for 1 year and just observe the OCT changes that occur. And a larger sample size would definitely help us in substantiating our clinical findings on OCT. Thank you.
In your study, all are large macular holes, no?
Yes, all are large, and majority were more than 600 microns.
Many are doing temporal flap technique, no, nowadays?
Yes, ma'am. The results are good with temporal macular holes. So this was basically done about 1 year ago. We are doing temporal flaps now. We are doing comparison of this multi-layered inverted flap with a temporal flap. And also we are trying to compare it with standard ILM peeling technique.
Okay. Okay, very good study. The next, thank you.